The doctors at WLS Surgical Associates have learned a great deal over the past 4,000 or 5,000 patients. We've learned that the following key factors help a patient decide, and that includes the amount of desired weight loss, the degree of diabetes, the severity of gastric reflux, and the severity of emotional issues. We consider an example related to the percent excess body weight loss. Then we see a patient who may weigh 350 pounds and whose ideal weight might be 150 pounds. So in that case, the excess weight is 200 pounds. So if we understand the projected excess body weight loss for the three procedures, we see that there is in fact some variation. And in that patient may expect to lose, for example, 160 pounds for the gastric bypass and 100 pounds for the lap band. So when we consider the operations, we always want to kind of know and understand what the expectations are. The second determining factor for deciding which operation is related to the degree of diabetes. Each of the operations has a different rate of correction of insulin-dependent diabetes. And so if you're a patient on insulin, the chances that you would rapidly correct that and come off all medication for diabetes is about 90% for the bypass, about 85% for the sleeve, and about 30% for the band. And therefore, sometimes that is an important characteristic for a patient in deciding which operation that they might consider for correcting their comorbid conditions associated with morbid obesity. Next important determining factor for which operation is ideal is related to the severity of gastric reflux. Looking at the picture, you can see that some people have acid that comes from the stomach and goes up into the esophagus. It can be worsened if there's a large hiatal hernia, which means part of the stomach is up above the diaphragm. The correction of mild reflux is common with all of the operations. The correction of severe reflux is fairly different. In those cases, when we see patients with very bad inflammation of the esophagus, certainly any precancerous changes, those patients do far better with the bypass because the acid and bile is instantly separated and no longer goes up the esophagus. With the band, in patients with severe reflux, sometimes too the band can offer an extra valve and can help some of those patients. The important factor is that in patients who are choosing or undergo a sleeve and they have severe reflux, we often are not successful at correcting that reflux. And so the severity of gastric reflux is an important component for a patient to decide the ideal operation in their particular case. One additional factor that sometimes plays a part in determining the ideal operation for each individual patient is related to the severity of emotional issues. The impact of severe depression and multiple medications on the success of the surgery is relatively low for the bypass and sleeve. Occasionally, somebody who is severely depressed might not be as successful with the band, related to the kind of eating choices that sometimes come to play in terms of achieving success. Overall, the vast majority of patients with most of the operations will significantly improve their state of depression and their overall quality of life. The overall goal of weight loss surgery is not simply to look better and feel better. The important outcome is really the resolution of medical illnesses. This slide shows for each of the operation, in summary form, the correction of diabetes, hypertension, sleep apnea, high cholesterol, joint problems, and gastric reflux. These are the key problems facing America and facing each individual patient. As outlined in the previous slides, the degree of improvement with different operations sometimes does influence the ideal operation. but we never get far away from the realization that these operations work and they help society tremendously. This slide includes a comparison of all the procedures. Our goal is to make sure that each individual patient ends up with the perfect operation for their success. As we've described earlier, the percent excess body weight loss is different for different operations. The bypass and band are reversible, each with a approximately 1 hour laparoscopic procedure. The sleeve is not technically reversible since we can't put the stomach back. However, it could in some cases be modified to a bypass if patients developed reflux or other problems. Pregnancy is possible after the first 6 months in any of the operations. And then finally, there are some features that are common to all procedures. They are all laparoscopic with basically 5 small punctures. The return to work is all about the same, approximately 2 to 3 weeks. The feeling for this practice is that most patients require regular vitamins, iron, calcium, and vitamin D. The only specific nutritional addition required is vitamin B12 for the bypass patients. Our group follows these vitamin levels closely and ensures that the function of your body is in tip-top shape, allowing for maximum metabolic rate. So we're left with a slide that talks about the factors for success. Our feeling is that lifetime follow-up is important. If patients are not able to physically come in, it's critical that you contact us by phone or through your doctor. Patient compliance and commitment are an important factor in success. It's the goal of the doctors to help identify appropriate patients, and it's the goal of the patients to identify surgeons with appropriate experience and skill. We've also found that clinical outcomes monitoring is an important way to judge the quality of a program. And that means that the program is monitoring every patient for complications and effectiveness of the surgery. It is a true multidisciplinary approach that involves dietitians, surgeons, psychologists, and back office people. Now that we've talked about the medical problems of obesity and the surgical solutions of obesity, we can spend a moment talking about why WLS Surgical Associates. First and foremost is the experience of over 4,600 procedures, including revisions, sleeves, bands, and bypasses. This represents one of the broadest experiences in the country, and it helps to lead us to the national reputation that WLS Surgical Associates enjoys. The practice has been designated as a Center of Excellence practice, and there are individual surgeons who have been designated Center of Excellence surgeons through the American Society of Bariatric and Metabolic Surgery. One of the final attributes that sets our practice aside is the amount of clinical research that is performed on an ongoing and annual basis, leading to presentations and publications that generally lead to a safer, simpler, and more effective procedure. We do want to remind you that the bariatric program participants include both the patient and the family. We realize that the family often represents the most substantial support that the patient will receive. The physician is obviously a participant, but we also need to involve the behavioral health providers, including the psychiatrist and the psychologist, an exercise physician, nutrition counseling, a bariatric program coordinator, and support groups, whether through the individual hospital or at your workplace. These are all the participants that will help the individual patient be optimally successful. We're fortunate to work with a dedicated group and dedicated individuals in each of these categories. We would like to thank you for taking the time to review this video presentation from WLS Surgical Associates.